My name is Dr. Harsha Deoghare. Students recognize me as Dr. D because I have a very long name, so it's very convenient with Dr. D. I come from a small town in India. I did my bachelor's in physiotherapy from India, and after that I did my PhD in rehab science from University of Florida, and then I worked at the California State System in the DPT program as a faculty before I joined WesternU in 2014, and since then I have been with the university. I served as an associate professor, and now I serve as the chair of the department, as well as at the college level I serve as the associate dean for research, and that's been my journey so far with WesternU. WesternU, because of its specific location, we have a community that has a lot of need. And we have students who require the training to really take care of the community. So this is a really good symbiotic match. At WesternU, we really participate in the building of the surrounding community in Pomona and beyond. We take part in the different health fairs where our students provide pro bono services under our faculty supervision, which kind of provides them the learning experience of working with really diverse and complex patient populations. At the same time, it provides for the healthcare needs of the community. We have a lot of different student groups on campus which participate in different healthcare related communities beyond just our local community. And there are several other ways our university is participating in paying back to the local community. The pandemic showed us kind of our health is dependent on the health of the weakest member of our community, and that was the only way we could actually stop the spread of the pandemic. If we have a healthy community, that's kind of a protection for ourselves as well. And when we're looking at the access to care, we really see that a lot of underserved minority groups are affected by it, and collectively it's affecting the health of the entire community, and therefore participation in providing them the required access to care, as well as participating in providing the programs like the health career ladder that we have here, which allows the youth from this community to really move towards education and career pathways in healthcare education, which can really make a difference and bring those diverse populations into the mainstream healthcare workforce. Giving is really important, as when we are giving, we are kind of participating in paying it forward, because all of us are supported throughout our journeys in education by someone else's philanthropy or niceness. Personally, for me, my journey at University of Florida in my PhD process was supported through the alumni fellowship. It paid for 4 years of coursework, tuition, as well as stipend, and that's the only reason I could complete my PhD in the rehab science process. I mean, as an institution, we are all about our students. The learning events are the most important events that happen on this campus, and this faculty and student interaction is the main event, and everything else is kind of support services. Our students are coming from a very diverse, underrepresented background, and therefore supporting them is really going to be helpful in creating a workforce that really represents the population that they're going to serve. And research shows that once the patient can really connect with their clinical providers, there is a pretty strong compliance in the treatment that they receive, as well as pretty higher rate of seeking for care when they can really relate to the care providers. And therefore, when we invest in our students, we are really making sure that we are making a difference in the age-old problems that our healthcare system in the US has, by making a difference on both sides of the field. I'm again really proud that we started an endowment, my wife and I, and the whole reason was to really pay it forward. Similarly, how me, my family are supported throughout my education, I want to make sure that this endowment supports students coming from diverse background in their journey of becoming a therapist, and this endowment is supported beyond myself by the faculty and staff at WesternU Department of Physical Therapy, as well as students and current students also invested in this, because they know that every dollar is going to count and every dollar is going to be invested in the success of our students.